Hi guys, it's me, Professor D, and welcome back to my channel. If you have not done so already, please be sure to press that like and subscribe button below. Liking my videos, that's actually what keeps the content and videos coming. Please, if there's anything that you'd like to see me do a video on, or tutorial, or content you'd like for me to cover, be sure to put it down in the comment section. I'll put it on my list and I'll make sure that I make a video for you. Okay, so we're going to be practicing questions. Let's jump into it. The first question: a child with cystic fibrosis is being discharged after initial diagnosis and treatment. The mother's been instructed about nutrition for the child and the need for pancreatic enzymes. The nurse is confident the mother understands about the home care of her child when stating, "I know it will be important for me to 1. Restrict the amount of salt in our foods, 2. Limit fluids to avoid swelling and increased fluid buildup, 3. Make sure the pancreatic enzymes are taken with all snacks and meals, or 4. Prepare separate meals for my child." And I'll give you a moment to think about your answer. So the correct answer, guys, is 3. The mom understands the nature of the disease, cystic fibrosis. So she said she says she's going to make sure that she gives, she puts the pancreatic enzymes on the food for every meal, every snack. So what's happening in cystic fibrosis is patients making a whole lot of mucus plugs. Okay, and the mucus is just thick, tenacious, and it's just plugging everything up. Sometimes the patient gets it in their lungs and they can't breathe, and sometimes what happens is they clog up the patient's pancreas. Now remember, the patient's pancreas is responsible for releasing enzymes. That's what's known as the pancreatic enzymes. Well, those enzymes are supposed to go in the small intestine, because remember, digestion of food happens where? In the small intestine. So that's what's supposed to break down the food. So what happens is the patient with cystic fibrosis has all of these plugs that are plugging up the pancreas. The pancreas is unable to release those enzymes. So if it's unable to release enzymes to the small intestine, that means the food that's going to the small intestine is not getting broken down. So that's what the mom understands. Every time that child eats, just like the normal pancreas, when you eat, it automatically shoots out and releases these pancreatic enzymes. She understands that every time her child eats, since the child's pancreas can't do it, she has to do it for her. So she's going to sprinkle the pancreatic enzymes on the food, so when the child eats, it can get broken down in the small intestine. Next question. A young client is brought to the psychiatric hospital by the parents. The client is poorly groomed, and the parents report that the client appears to be hearing voices. During the first few hospital days, which of the following would be a priority for the nursing intervention? 1, see that he bathes and changes his clothes daily. 2, complete the standardized admission assessment of the client. 3, observe the client carefully to see if he approaches the staff. Or 4, seek him out frequently and spend short periods of time with the client. And I'll give you a moment to think of your answer. The correct answer is 4, seek him out frequently to spend short periods of time. So with this question, we see that, you know, the client's hearing voices. We're thinking client's probably schizophrenic, right? And we know that schizophrenics tend to be what? Very, very suspicious. So the reason that you're seeking out that client and spending short amounts of time with them is because you're trying to build a rapport. You're trying to build a trusting relationship, because if you don't do that, the client's not going to want to bathe. They're not going to want to go to therapy. They're not going to want to take their meds. They're not going to want to express their feelings. Nothing. Your first priority for that client when they come into your facility is to build a trusting relationship. Okay? Remember, people over paperwork every single day of the week. Next question. A client's admitted to the hospital after a motor vehicle accident with a diagnosis of blunt chest trauma. Analyzing the client's arterial blood gases, the nurse recognizes which value as being consistent with acute respiratory failure. 1, pH of 7.36. 2, partial, I always forget how to say this, a partial CO2 of 72. 3, O2 of 78, or 4, O2 sat of 90%. And I'll give you a moment to think about your answer. And so guys, the answer is 2, your CO2 of 72. So I want you to think about this, guys. When the patient's in respiratory failure, that means they're not breathing the way they're supposed to be breathing. You breathe in, oxygen, out CO2, right? But now their breathing's compromised. So what's happening? They're holding on to their CO2. Instead of breathing out that CO2, which is what? Acidic. They're holding the CO2 in, which places them at an acidic state. So how do we know if a patient's acidic? Well, we know our pH level is 7.35 to 7.45. Anything higher than 7.45 is alkalinic or basic. Anything lower than 7.35 is acidic. What about CO2? CO2 levels is 35 to 45. And remember, I told you CO2 is what? Acidic. So the more CO2 you have, the more acidic you are. If I told you CO2 is 35 to 45, this patient's CO2 is 72. That means they have a lot of acid. So that's what lets us know the patient's in an acidic state. When we see them in acidic state, we see the CO2 go up and we see the pH go down, because the lower the pH is, the more acidic the patient is. The higher the CO2, the more acidic the patient is. So let's look at our other choices. Number one said a pH of 7.36. Well, that falls into the normal range because I just told you that the pH is 7.35 to 7.45. So that's fine. Next one, O2 is 78, your partial pressure of oxygen. Then let's not confuse that with SaO2. SaO2 is your O2 sat. The O2 sat, we want it 98 to 100. Some textbooks say 95. We'll take the 95, nothing lower than the 95. But partial pressure of oxygen, you want it 88 or higher. This one's 78. It's a little bit low, but it does not tell us that that patient's acidic. Why? Because it's the O2 that's low, not the CO2 that's high. And our last choice is the O2 sat of 90. That's not good. We want the O2 sat to be 98 to 100. Some textbooks say 95. We'll take the 95. But even though that O2 sat is 90%, that still doesn't tell us if the patient's in acidic, because remember I said in acidic state, the pH is going to be down and the CO2 is going to be up. So the only possible answer that could have been in these choices is number 2. Guys, do not confuse partial pressure of oxygen with your O2 sats. Your partial pressure, you want it to be 88 to 100. Some books say 85. So 85, 88 to 100. Where your O2 sat, you want it to be 95 to 100, 98 to 100, depending on the textbook that you're using at your school. So next question. In which of the following situations would the nurse know the administration of magnesium sulfate to be contraindicated? 1, stop the onset of labor at 32 weeks gestation. 2, reverse the effects of Pitocin hyperstimulation in a laboring client. 3, prevent seizures in the client with pregnancy-induced hypertension. Or 4, treat uterine atony following vaginal delivery. And I'll give you a moment to think about your answer. And the correct answer is 4, guys. In my last video I did on NCLEX prep questions, we talked about this. I went over mag sulfate, okay? What does mag sulfate does? It relaxes the uterine muscle. So that's why 4 is the answer, to treat uterine atony, because uterine atony, what does it mean? That means those muscles are loose, they're boggy, right? But you want it tight, you want it to be constricting. So in this question, what they're asking you is, why would it be contraindicated? And that's the answer, to treat uterine atony. Guess what? If a patient has uterine atony, which means their uterus, the muscle is soft, it's boggy, it's not contracted, you give them mag sulfate, you're going to make it worse, because what does magnesium sulfate do? It relaxes muscles. Right? So that's why this is the answer. That's contraindicated. We are not going to give magnesium sulfate for uterine atony. What we're going to give magnesium sulfate is if the patient's having too many contractions, right? The contractions are too strong on that uterus and we need to relax the muscle. That's when we give magnesium sulfate. Another reason we give magnesium sulfate, guys, if a patient's in pregnancy-induced hypertension, they're close, they may get seizures, we may give magnesium sulfate, because another action of magnesium sulfate, it causes massive vasodilation. And we know whenever blood vessels dilate, what happens to the blood pressure? It goes down. So if a patient's in pregnancy-induced hypertension and it's really bad, we're worried about her going to seizures, we'll give her magnesium sulfate, and it'll cause vasodilation, and it'll cause the blood pressure to go down. Okay, next question. A client has a diagnosis of abruptio placenta. The nurse should assess the client's laboratory values for 1, increased platelet count, 2, prolonged partial thromboplastin time, 3, increased increased fibrinogen level, or 4, decreased clotting time. And I'll give you a moment to think of your answer. The correct answer, guys, is 2, a prolonged partial thromboplastin time. Guys, you see that answer 2? That is the one that promotes bleeding, okay? And I wanna explain this to you. So a patient has abruptio placenta. A patient has abruptio placenta. We're worried about that patient, what? Bleeding out. We're gonna be looking at the lab values, okay? Now, I want to go through these choices. I want to explain to you what's happening here. So you have 1, increased platelet count. Well, guess what? If the platelets are increased, what does that mean? The patient's clotting, which means what? They're at decreased risk for bleeding. Because remember, patients are bleeding when they don't have enough platelets or when the platelets are taking too long to clot. So 1 could not be the answer. 3, increased fibrinogen level. That increases clotting. Right? So that can't be the answer because we're looking for something that would cause the patient to bleed. Number 4, decreased clotting time. That also promotes clotting. The only answer here that promotes bleeding is a prolonged. That means it's increased, okay? An increased partial thromboplastin time. That's the only one that promotes bleeding, okay? I want you to think about it, guys. When you have clotting time, if the clotting time is increased, that means that it takes longer to clot. If it's decreased, it takes a short amount to clot. Sometimes, guys, when you guys are thinking about these questions, you have to stop for a minute because you know this. You went to school, you learned this information. You just have to stop for a minute, close your eyes, and think about physiologically what's happening in the patient's body for it to make sense. So you have number 41. A client with a diagnosis of borderline personality disorder has become attached to one of the nurses. One day, the favorite nurse calls sick. When given this news, the client goes in the hospital room, breaks a bottle of cologne, and scratches his arm with a jagged piece of glass. After providing first aid, what is the next most therapeutic nursing action in relation to the client's behavior? 1, institute suicide precautions. 2, help the client connect thoughts and feelings to the acting out behavior. 3, telephone the client's favorite nurse to talk with the client. Or 4, permit the client to remain alone to regain composure. And I'll give you a moment to think of your answer. Okay, the correct answer is 2, help the client connect thoughts and feelings to the acting out behavior. And so I want to talk to you about these other choices so you understand why the other choices are incorrect. You had 1, institute seizure precautions. Remember this patient's diagnosis. It's borderline personality disorder. That's the first thing I want to bring to your attention. And the second thing I want to bring to your attention is that they cut a piece of glass and they cut their skin. They didn't put in the jugular, they cut their skin. Okay, so something you guys got to know about borderline personality disorders. Many of them die, but they die by accident. And I want to explain this to you. Those patients that have borderline personality disorder, it's all about me. They want attention and they'll do whatever it takes to get attention. So what happens is many of them, when they're in the psych unit, they watch the nurses and they know when it's time for change of shift. And so what they'll do is they'll hang themselves or they'll cut themselves because they know that the nurse is going to come in, freak out, and then all the attention is going to be on them. But the reason a lot of them die accidentally is because during change of shift, something might happen and the nurse doesn't come in time and they accidentally killed themselves, or they might be home and they know their mom's going to come home soon and the patient ingests a bottle of pills, but maybe the mom had to work late and nobody came in time to save them. Okay, so we're not going to put them on suicide precautions because them scratching themselves was not a real suicide attempt. Okay, that's number 1. And number 2, we understand the nature of the borderline personality disorder. So even if we were going to put that type of patient on suicide precautions, we would have to assess them first, right? Remember, when a patient's suicidal, you have to ask those 3 questions. Do you have thoughts of harming yourself or anyone else? If you do you have a plan? And if you do have a plan, do you have access to whatever you're going to use? So let's say their plan is to kill themselves. Do you have access to a gun? Okay, so you have to ask those 3 questions anyway, so you couldn't just jump and put the patient on suicide precautions. So that's the wrong answer. 3, telephone the client's favorite nurse to talk with the client. You never reward bad behavior. Never. Because if you do that, they're going to act up every time they don't have their way. Remember, in psych, we do not enter into power struggles with patients, and we don't allow them to manipulate us. You're the nurse, right? So number 4, permit the client to remain alone to gain composure. No, you have to access. You have to assess the patient. Because what if they really are suicidal, but you didn't assess them to find out, and you left them alone and they hung themselves, right? So you have to assess. So the correct answer is 2. Help the client connect thoughts and feelings to the acting out behavior. You want that patient to express their feelings, okay? Next question. What would the nurse most expect to observe in a client with impulsive and acting out behavior? 1, good problem-solving skills. 2, commitment to long-term goals. 3, ability to delay gratification. Or 4, low tolerance for frustration. And the correct answer is 4. Guys, those patients who are impulsive and they act out, they have a very low tolerance for frustration. The minute they don't get their way, they're frustrated. They act on their emotions and they don't even think about the repercussions. They don't think about that. Why? They want immediate gratification. So their frustration tolerance level is very, very low. Number 46. A client known for making inappropriate sexual advances towards the nurse is diagnosed with antisocial personality disorder. The nurse knows that which of the following is inconsistent with the diagnosis? 1, grandiosity. 2, poor frustration tolerance. 3, intense guilt. Or 4, fighting. And the correct answer is intense guilt. Intense guilt, that's not a part of antisocial personality disorder. Let me explain to you antisocial personality disorder. Because I notice as students, you hear antisocial and you think, that's somebody that likes to only be to themselves. They don't like being around other people. Not in psych. In psych, antisocial personality disorders, those patients that have that diagnosis, they're social butterflies. They love people. Why? Because they're con artists. They're scammers. That's why they love people. They're social butterflies. So what happens is they'll be your best friend so they can figure out what your weakness is. And they'll prey on that weakness so they can either scam you out of all your money, or maybe they want to sleep with you, and so they pretend to be in love with you and they sleep with you and then they leave, whatever it is. But those patients who are antisocial, have antisocial personality disorders, they are social butterflies. They're chameleons. They will turn into whoever you need them to be so they can scam you out of whatever they want, okay? Those patients with antisocial personality disorders, they're the ones who will scam the 98-year-old grandma out of her life savings that she was going to leave her grandchildren in the will. He'll scam her. And those patients with antisocial personality disorder, they have no feelings of guilt. They feel like you deserved it. If you let me scam you, that's your problem. You should have saw it coming. Okay? They have low frustration levels. So let's go over the other choices. Number 1 says grandiosity. That is consistent with antisocial personality disorder. They think they're special. They think they're above the law. Okay, so remember, grandiosity means that people who think that they're special, they're above everybody else, right? So yes, that is consistent with antisocial. 2, poor frustration tolerance. Yes, that is consistent with antisocial personality disorder. Their frustration tolerance is very, very small. They need to have their way, and they will do anything that they have to get their way. And of course, fighting. They'll fight if they have to get whatever it is that they want. The only one that is not consistent is intense guilt. They never feel guilty about scamming whoever they're scamming or whatever they're doing. When they scam somebody, they feel good about it. They feel like the person should have saw it coming. Okay, next question. A client calls a hotline and threatens to commit suicide. Which would be the most important question for the nurse to ask? 1. Have you attempted suicide before? 2. What happened to make you so desperate? 3. How will you carry out your plan? Or 4. What will you accomplish by taking your life? And guys, I'm not even going to give you a second to answer this question because I just answered it for you like 2 questions ago. You're going to ask them 3. How will you carry out the plan? When it comes to suicide, you have to ask those 3 questions. If you suspect they're suicidal, you ask them directly. Don't beat around the bush. Do you have thoughts of harming yourself or others? If you do you have a plan? And if they have a plan, do you have access to whatever you're going to use to kill yourself? You must ask those 3 questions when it comes to suicide, okay? Next question. The client has a pituitary tumor removed. Since the pituitary cannot secrete ADH at this time, how will this suffer her fluid and electrolyte status? 1. Large volumes of water will be excreted. 2. Large amounts of sodium will be conserved by the body. 3. Large amounts of potassium will be retained. 4. Large amounts of magnesium will be retained. And I'll give you a moment to think about your answer. And the correct answer is 1. Large volumes of water will be excreted. I want you to think about this, guys. The pituitary gland, that's responsible for what? ADH. Anti-diuretic hormone. Anti-diuretic hormone, that's what makes you reabsorb the fluids that you don't need to get rid of, right? So if you don't have anti-diuretic hormone, what happens is you're doing what? Urinating all over the place. You're urinating to the point of what? Dehydration. So that's why number 1 is the correct answer. Without ADH, the patient's going to be secreting large volumes of water, okay? Next question. A nursing assistant on the pediatric unit may be pregnant. The charge nurse is unsure of the nursing assistant's immune status. Which of the following hospitalized children could the charge nurse safely assign to the nursing assistant to care for? 1. A 2-year-old with impetigo. 2. 4-year-old with varicella. 3. 6-year-old with rubella. Or 4. A 9-year-old with Fist disease. And I'll give you a moment to think of your answer. And the correct answer, guys, is number 1, a 2-year-old with impetigo, okay? That impetigo, guys, this is a bacterial infection, okay? But you see 2, 3, and 4, these are viral infections. Not only are they viral, they're contagious. So you're not going to give 2, 3, or 4 to the pregnant mom. Next question. The nurse is aware that an aggressive hospitalized client is one who 1, stops away from the nurse's station, grabs a pool cue, and steps towards a client standing nearby. 2, bursting into tears, leaves the community meeting, sits on his bed pounding his pillow and sobbing. 3, says to the primary nurse, "When you told me that I couldn't have a pass, I wish that you would fall down the stairs and crack your head open." Or 4, tell the nurse that I'm not going to take that or any other medication and you can't make me. So guys, the only patient in this group that's actually exhibiting aggressive behavior is number 1. That patient that stomped away, picked up a pool cue, and was stomping near a patient. Why? Because they may potentially harm the patient. That's aggressive behavior. 2, 3, and 4, we're not worrying about them harming anybody. That's not aggressive behavior. 2, the patient runs away in tears and goes to their bed and they're pounding the pillow. 2, they tell the nurse that they wish that the nurse fell down the stairs. And 3, they tell the nurse, "You can't make me." None of those are behaviors that can potentially harm someone else. The only one in this situation that can harm someone else is number 1, okay? And that's showing aggressive behavior. Next question. While admitting an 11-year-old child for elective surgery, the parent asked the nurse, "Is it true there's an IV medication kids can give themselves if they have pain after surgery?" In responding, the nurse is guided by which of the following principles regarding the use of patient-controlled analgesia, PCA, in children and adolescents? 1. Children who have reached Piaget's stage of concrete operations can be taught to use PCA. 2. Adolescents on PCA have a tendency to over-medicate themselves in order to feel high. 3. It may be necessary for the parent to assist the child by pushing the release button when needed. Or 4. The use of IV narcotics should be avoided in children because of the increased risk of overdose. And I'll give you a moment to think of your answer. Okay, guys, so the correct answer is 1. Children who have reached Piaget's stage of concrete operations, which, guys, usually that's around 9 to 11 years old, they can be taught to use the PCA. And the reason they can be taught to use the PCA, guys, concrete operations, this is when they're able to think logically, right? And they're able to think logically towards physical objects. So you can tell that patient, when you feel pain, you can press this button and it'll give you a certain amount of prescribed pain. Let me tell you something, guys. With the PCA, the patient cannot overdose because there's a prescribed amount of medication that will be given. So, for example, if the doctor orders 50 micrograms to be given every 4 hours as needed, right? Every 4 hours, if that patient presses the button, the most that the patient is going to get the 50 micrograms, and that's it. The patient can press as many times as he or she would like. After that prescribed amount, the patient will not get any more until the next 4 hours. Okay, so that's very important. The child has to be cognitively developed in order to be able to use the PCA, and that's usually around that, like I said, 9 to 11 age. That they can logically be able to do that. Now, something else I got to tell you about the PCAs. If you have not watched my delegations video, please be sure to do so. I talk about what the RN has to do. They can't delegate to anyone else versus what the LPN is allowed to do versus what the CNA, PCA, UA, whatever you want to call them, what they're allowed to do. So when it comes to PCAs, only the RN can keep that patient. If a patient has a PCA, the LPN can't keep that patient. The RN cannot delegate a patient that has a PCA to an LPN. The RN must keep that patient. What else do you need to know about PCAs for testing? Oh, here's another one. You have to teach the family members that only the patient should press that button. Okay, because what happens is the patient might be sleeping and family's visiting, and in the sleep, the patient happens to moan. They might be dreaming, but guess what? The family's like, oh my gosh, they're in pain, and they push the button. If that patient was really in pain, they would have woken up from sleep and pressed the button themselves. So we don't want the patient to be medicated unnecessarily. Okay, that's why we teach them that only the patient should be pressing the button, no one else. Okay, guys, last question. During conversation with the nurse, a schizophrenic client uses the word evoreation. How will the nurse interacting with the client interpret and respond to the use of the word? 1. Evidence of his illness and ignore it when interacting with the client. 2. A mispronunciation and indicate to the client that the staff does not understand its meaning. 3. Evidence of his illness and clarify the meaning with the client during the interaction. 4. Mispronunciation and correct the client's grammar when interacting with the client. I'll give you a moment to think of your answer. Okay, guys, the correct answer is 3. Evidence of his illness and clarify the meaning with the clients during the interaction. Now, they gave us a clue. They told us that that patient was schizophrenic, and then they gave us a word, evoreation, which is not a word. That's something that's made up, right? Patients that are schizophrenic, they tend to have neologisms. And what is that? Or some pronounces guys, I'm sorry, my pronunciation is horrible. Neologism. So I'll spell it for you. Neologism. Neologism. So what that means is a made up word, but it only means something to the person who made it up. So these schizophrenics, they tend to make up these words, and the words have meaning, but it only has meaning to them. It doesn't have meaning to anyone else. So as the nurse, therapeutic communication is to say to the client, I don't know what you're saying. Can you please explain? Okay? When you say, I don't know what you're saying, you're bringing them back to reality. You're letting them know whatever they're saying makes no sense. And then you follow it up with, can you please explain? You're allowing them to express their feelings. You're allowing them to talk. And that's what psych is all about. Open-ended questions, allowing the patient to express themselves. Now, remember what I taught you when we were doing the psych questions. You always want to put it on yourself and not the patient. So you never say to the patient, you're not making sense. When you say you're not making sense, you're putting it on them, right? You never do that in psych. You put it on yourself. You say to the patient, I don't understand what you're saying. Can you please elaborate, or can you please explain? So guys, I hope this video was helpful. Guys, I hope the questions and the rationales were helpful to you. If they were, please let me know. Let me know in the comment section. Don't forget to press that like button, and don't forget to subscribe to my channel. That's what keeps the videos coming. Thank you so much for joining me, and I look forward to doing the next video for you next time. Bye.